Hello, I am pleased today to be joined by Mrs. Doris Montserrat, a member of the European Parliament and the former Minister of Health, Social Services and Equality, the Ministry of Health and Social Services and Equality of Spain. I am Elias Zerhouni. I'm the former head of the US National Institutes of Health and also a founding member of the board of the Davos Alzheimer Collaborative. Mrs. Montserrat, thank you for joining us today and spending the next 20 minutes together. Thank you for your active participation in previous Lausanne discussions. On behalf of all of us, we want to thank you for your leadership in addressing Alzheimer's disease and also your interest in helping the Davos Alzheimer's Collaborative grow our impact in Europe. And first and foremost, I really like to ask you a question and to start the conversation by just asking you, why are you so passionate about Alzheimer's? I mean, there's certainly many areas you could focus on and many demands on your time. As a former minister, I know you'd had a tremendous amount of issues to deal with. So what is it about Alzheimer's disease that attracted you? Why Alzheimer's disease for you?
First of all, thank you, Elias, for your welcoming words. And once again, thanks to George for having me here and to all the people of the Davos Alzheimer's Collaborative. And thanks as well to all the experts from public and private institutions all over the world, from the industry, the academia, the governments and civil society, from whom we had the privilege to learn in the last 4 days, through a global interdisciplinary scenario on where we stand now and the innovative solutions we can improve, and working all together in the fight against Alzheimer while renewing our compromise to stop this disease by 2025. Well, you were asking me, my passionate. Well, you explained that I was the Spanish Minister of Health, Social Service and Equality, and for me, mental health has always been one of my priorities. Why? Because there is no health without mental health. Moreover, in any disease, mental health can help us face physical illness with a better attitude and a stronger immunity system. Today, 10 million people aged over 60 across Europe suffer from Alzheimer's disease and other forms of dementia. And this number will grow to more than 14 million by 2040. So if we don't act now, we are going to face a silent pandemic with a devastating healthcare, social and economic impact in all the European countries. So this is the reason why I have a big compromise with Alzheimer's disease, because the Alzheimer's disease is not just a disease, it's more a disease. It's a social, economic, labor impact in all European countries, and of course, all countries around the world and all the citizens around the world. So we can do a lot of things together, and let's do it. And I think so that this summit today is very important to fulfill this objective.
It's interesting what you say, because there are so many other priorities you could focus on, but Alzheimer's disease has an impact beyond affecting the patient. It affects the society, it affects the caregivers, and it affects countries. What is the European Parliament doing to address the growing impact of Alzheimer's disease in Europe, given the epidemiology that is mentioned in many papers about the growing, slow-rolling pandemic of Alzheimer's disease, not just in Europe, but worldwide?
Exactly. Well, even before the pandemic, the European Parliament and the European Commission declared health as one of the top priorities of this European legislation, started in 2019. The COVID pandemic showed us as never before how health, the economy, and social well-being are deeply interconnected. Alzheimer's is not only a health disease, but also a social, employment, and economic threat, which to be effectively faced needs more European Union centralized and coordinated actions. In the last 2 years, we act the European Parliament have been working with the European Commission on a series of legislative and non-legislative proposals that will drive what we consider the next European decade of health, together with the ecological and digital transition and other objectives that the European Union has. We want to improve the protection of the European people's health, including the fight against Alzheimer, building a European Union of Health with a more prominent role of the European Union in coordinating the member states, especially in health emergencies, a health in all policies approach to address the weakness of the health economy society interconnections, the resilience and sustainability of our national public healthcare systems, and a new pharmaceutical strategy for Europe, for which I'm the rapporteur for the Parliament, which puts neurodegenerative disease as one of the 4 main unmet medical needs to be addressed in the European Union. So, we have to reinforce European Union health agencies and a new authority for health emergency response, HERA, like the BARDA in the United States, and new ambitions for the first time autonomous European Union for Health program. So with a budget of 5.3 billion euro, more than 10 times the previous one. So we have really in Europe, our objective this decade is the health, the innovation, the research, and of course, one of the unmet needs. We have more, and of course that we are going to put our efforts that all the unmet needs, but one of the biggest important unmet needs is the neurodegenerative, so the Alzheimer's. So we are putting a lot of tools, programs, funds with fighting against the Alzheimer in Europe.
It's interesting because you come to this role at the European Union with prior experience as the Minister of Health in Spain. And during your time, there was the implementation of the country's dementia strategy. I'd like to ask you, what lessons did you learn? What has been the biggest impact of your national plan against dementia?
Thank you very much. Let's see, I learned a lot of things when I was minister. We facilitate the state working group on dementia, which prepared the national plan on Alzheimer's and other dementias, built on the result of the application of the National Health System Strategy on neurodegenerative disease between 2016 and 2019. So the plan highlights that healthcare systems preparedness is key. Planning ahead and making healthcare systems fit for the future requires. For example, awareness raising about the disease, particularly the first warnings of early dementia. This is very important. Training primary care physicians to identify early symptoms of Alzheimer's disease and support systematic screening of at-risk populations. And third, ensure access to Alzheimer's detections and timely diagnosis, as well as potential treatments when they become available. Because, we don't want, as a patients, as a citizens, we don't want to go around to the different hospitals or primary health care and nobody detention our disease. So for us, it was very important to do this plan and to prepare these primary care physicians to identify early symptoms of Alzheimer's disease. This is very important for the patients and for the family. And I think so that this can help all around Europe, but all around the world. We have to prepare the primary care to have this early identify symptoms of Alzheimer's.
It's interesting. When I was the director of the National Institutes of Health in the US, we knew that it was extremely important to focus on Alzheimer's disease because of the impact over time. One of the things we found was that to really be able to develop new therapies, we need to understand the disease and its heterogeneity. The fact that you see, for example, patients who are fast progressors, and when they develop it, they develop very quickly to a terminal stage. Others are slow progressors. Many, many questions. But the key thing was, as the trials were done, in the A beta sort of antibodies, what we found was that the patients who were diagnosed earlier in the disease process did better, both in terms of prevention as well as in terms of the therapies. It seems to me that the Davos Alzheimer Collaborative, we're trying to get exactly what you're describing, a comprehensive solution that starts from the natural history of the disease early on. How do you diagnose it? How do you differentiate it from other components? And then that will be guiding us. But to me, and I'm really curious to hear what your thoughts are on this. How do we really change the course of the disease? Because we may not have a cure, and it's possible that by the time you develop Alzheimer, there's nothing much we can do to bring you back to normal. We have to intervene early. And we know that Alzheimer starts 20 years before. So we know the rates of diagnosis of Alzheimer's are around 50%, both in Spain and across Europe, as well as in the US. So in your view, what should we do? What should we do to increase the diagnosis rate and the ability for us to identify the population at risk early so that we can do something therapeutically?
Yeah, well, first of all, I'm totally agree on what you were explaining, Elias. Many studies in different countries show that more than half of people living with some form of dementia do not receive a diagnosis. So even for those who do receive one, post-diagnostic support is often poor. And people living with dementia and their families are too often left to look after themselves without a clear idea of what service might be available to them. So to increase diagnosis rates, we need to focus on early diagnosis. You were explaining that, especially on a screening and early detection of mild cognitive impairment and dementia, in the hopes of understanding who is at risk of Alzheimer's disease in earlier stage. Some research has shown a relationship between the development of cognitive impairment and lifestyle-related risk factors that are shared with other non-communicable disease. So these risk factors include physical inactivity, obesity, unbalanced diets, tobacco use and harmful use of alcohol, as well as diabetes mellitus and midlife hypertension. So other potentially modifiable risk factors include midlife depression, low education attainment, social isolation, and cognitive inactivity. The earlier we succeed to diagnose dementia caused by Alzheimer's disease, the faster we will achieve to prevent it and stop its spreading. So a multidisciplinary integrated approach to screening and early detection is key to detect dementia symptoms before the neurodegenerative degeneration will be too much advanced, to identify biomarkers and feed research on innovative drugs. In the age of big data and artificial intelligence technologies, the goal of more precise early diagnosis and prediction of the progression of dementia may not be very far away. I think so that we have to use the big benefits that big data and artificial intelligence technology is giving to us. For example, now in Europe, we're going to create a big data, health big data, that we are going to include 1 million genetic from the 1 million citizens. So this is going to give a lot of information, a lot of information to prevent a lot of disease, of course, Alzheimer too. So I think so that we have to take this way.
You know, it's interesting. I mean, you really are thinking about it in a comprehensive way. This is the same thing with the Davos Alzheimer Collaborative. You know, when we started this 2-3 years ago, thanks to George and his energy, one of the things that I contributed to was the sense that we will not be able to understand Alzheimer's disease unless we had a global approach. And the reason you want a global approach is because you want to separate what's the impact of genetics as opposed to the impact of the environment. Today, 95% of all the research is done on Caucasians. We need to really understand the heterogeneity of the disease, the differences from country to country, because at this point, as a scientist, I can tell you, we have many theories, but we are not clear as to exactly what happens in patients around the world. And yet, you know that the technology to diagnose Alzheimer's disease, as you said, is evolving. So for example, for us, one of the 3 pillars of our project is to create a global cohort of patients that will be followed over years with new tools, new methodologies, like the iPhone, for example. You know that if you can record your voice, you can see the changes over time and actually predict from iPhone activities what I call culturally independent methods of diagnosis. Because as you know, when you try to diagnose Alzheimer's, you're dependent on the language, you're dependent on the culture of the patient and the doctor who's treating the patient. So we're trying to do, as you said, you know, using digital biomarkers that can make use of AI to diagnose disease earlier worldwide with a single harmonized standard therapy. Now, from your point of view, how can you help? What would you recommend we do to get the most help possible to succeed? I mean, obviously, this is a global project. It's not just Europe or the US or Asia, or it's everywhere. Given your experience, what would be your advice to us?
Well, I think so that busy. Yeah, well, I think that this initiative is very a good initiative. Why? Because we are everybody here, not just Europe or perhaps Europe alone. We cannot do it, and we cannot do it each state member alone. So the COVID give us a big experience that alone perhaps we wouldn't have all these vaccines. So we got big lessons of COVID, and not just each state member, not just European Union, not just United States, not just each country. We need, you know, an initiative like this one that everybody can give their positive initiatives to all together work together on that. National plans in health are key mechanism if a comprehensive and coordinated response is applied. Addressing dementia requires collaboration among all stakeholders to improve prevention, risk reduction, diagnosis, treatment, and care. Achieving such collaboration requires engagement at the government level of all relevant public sectors, such as health, social service, education, employment, justice, and housing, as well as partnerships with relevant civil society and private sector entities. So we need social policies for supporting families and carers in family environments, and promote healthy aging and cognitive training that effectively reduce the prevalence of the disease, to tackle our dependence with less dependence. But we have to do it all together. So all this experience that I'm explaining as former Minister of Health in Spain, I think so that we have to share not just European Union, we have to share all global. So we urgently need to strengthen North-South, South-South, and triangular cooperation to implement a global dementia health and socioeconomic research agenda, as well as a new clinical trials global system and big data digital interoperable system that will increase the effective progress globally towards better prevention, diagnosis, treatment, and care for people with dementia. Initiatives like the WHO Global Action Plan on the Public Health Response to Dementia 2017 to 2025, the Global Dementia Observatory just launched by the WHO, the new European Union of Health we keep building are showing the right path to follow. So the Davos Alzheimer Collaborative represents a unique, powerful catalyzer for all the global efforts against Alzheimer's disease. And if I should ask something to this group, it would be to keep setting the bar at the highest level for research and innovation development, showing us that only through a global multi-stakeholders high-level collaboration, we will be successful in leaving no one behind, no matter where he or she lives, and stop this disease by 2025. So I think so that perhaps, my conclusion in this question, it is, look, take all the good experience of all of us and put it in these initiatives, that this one, the Davos Alzheimer Collaborative, because I think so that all together we have a lot of solutions. So let's put it all together. Do not work alone, each country, because if we are working all together with all the big experience, with all the big data, I'm sure that we are going to help all the citizens, all the patients around the world with Alzheimer's disease.
Well, listen, you're now part of the family, and we're really looking forward to working with you, because I agree with you, unless you have a global collaboration to build the Davos Alzheimer Collaborative into a global mechanism for collaboration at scale, it will not accelerate, if you will, if you can't do it. And I think with your guidance and what you just said, it's really important for us to accomplish that and create that crystallization of thoughts around leaders around the world, for leaders around the world, to advance our challenge here towards a solution to the Alzheimer's disease. So I want to thank you for being here and for sharing your passion. I think this brings us to the end of our time together, but I want to really share with you the fact that these Lausanne meetings are in fact meant to stimulate action and collaboration, as George Radenberg never lets anyone slip away from his network, to accomplish the mission that you've described and that we all believe in. So with that, I want to thank you for your participation. And now I turn it back to George. And George, back to you now.
Thank you very much, Elias, and thank you to George. And I hope so that one day we can meet each other in Davos presently after this pandemic of COVID. So I hope so that next year we can be all together sharing in Davos these big discussions and these big solutions for all our citizens that has this Alzheimer's disease. Thank you very much.
Thank you, Doris.